Well, welcome everyone. Welcome to Healthcare Without Harm's webinar, Marketing and Promoting to Support Purchasing Strategies. This is part of our Improving Antibiotic Stewardship in Animal Agriculture webinar series. Today is October 4th, 2016. My name is Hillary Bisnett, and I am the National Procurement Director for Healthcare Without Harm's Healthy Food and Healthcare Program. I will be moderating today's webinar. Welcome and thank you for your participation. Before we get started, I have a few reminders and logistical details to share. First, this webinar will be recorded and will be made available for your viewing on our website. Once the conclusion of this comes, we'll send you an email with a link to the recording and other reference materials once it's made available. Melanie will be providing technical support today. If you need AV support, please send any questions via the direct chat to her. You should see her name with the chat option in the lower right-hand side of the screen. We have reserved time for questions and answers at the end of the session. You can submit questions for the speakers or myself throughout the presentation via that direct chat feature to Melanie. We wanted to start off with a little bit of background on antibiotic resistance before we dive into today's presentation. I hope we all know that antibiotic resistance has been called one of the world's most pressing public health problems today. It causes illnesses that were once easily treatable with antibiotics to become dangerous infections and even causing death. We also know it contributes to 8 million additional hospital days per year, costing healthcare $20 billion each year in direct expense. Although some people think a person becomes resistant to specific drugs, it is the bacteria, not the person, that becomes resistant. Microbes have developed resistance as a mechanism of survival. With this said, we also know that 80% of all antibiotics are used in industrial animal agriculture for meat production. So today, the healthcare sector is no longer just focused on facility-acquired infections. They know that there are multiple routes of human exposure to these resistant bacteria, included through contaminated meat, workers who carry bacteria back to their homes and communities, and through animal sewage that's applied to fields which can be contaminated crops and of our water supply. So Healthcare Without Harm is asking the sector to look at the root of the issue as well. The industrialized meat system made up of confined animal feeding operations that continues to consolidate and be owned by just a few large companies didn't create itself on its own. We know this system was responding to the demand for meat, and while working to create more efficiencies, these integrated businesses seem to be putting their best foot forward. This is when the company owns the hatchery, the feed mill, and the processing plant, leaving the part of the equation with the most risk for producers through the use of grower contracts. So now it is time to model healthy, sustainably raised food choices. Hospitals have the ability to menu options that do not harm public health through contamination of air, water, and soil, nor through the contribution to antibiotic resistance. Before we turn today's webinar over to our guest speakers, we wanted to give our guidance around the topic of marketing and promotion. Healthcare Without Harm has created a new resource for hospitals called Promoting and Marketing Antibiotic Stewardship through Food Services. This is a guide for food service staff to educate and incentivize around meat and poultry raised without routine antibiotics. Healthcare Without Harm and Practice Green Health work with a growing network of hundreds of hospitals and healthcare facilities working on this critical issue. We've heard from many of you and wanted to share some of these best practices. This resource assumes your facility has made a commitment to antibiotic stewardship and is working towards the goal of reducing antibiotic misuse and overuse through food service procurement. If you are also looking for ways to educate your patrons about why this issue is important, and on top of it all, sell plenty of delicious, healthy meals made with these ingredients, this is the right resource for you. By calling attention to these products wherever you can in repeated ways, sharing your sourcing story, and connecting it to your facility's mission, you can entice patrons to try your meals and educate them all at the same time. Both polls and purchasing preference data are showing that more and more consumers are seeking out natural, sustainable, and local foods with clearly defined and responsibly sourced ingredients. And food service operators are responding. According to Food Service Planning Program Operator Survey, 79% of food operators agree that no hormones or antibiotics are sustainability factors that will have great or moderate influence on purchasing decisions in the future. Honest sourcing ranks in the top 5 non-commercial food and beverage trends in 2016, according to Technomic. They report growing consumer interest in clean and ethical sourcing is impacting the non-commercial food service in a big way. Clean eating, the idea of sourcing largely natural and organic products, will find more proponents. As transparency grows across segments, operators will further spotlight humane working conditions as well as eco-initiatives that center on sustainability and waste management. In order to promote, market, and generate excitement for your meals, food service operators have commonly followed the 4 Ps of marketing: product, promotion, price, and placement. In addition, Healthcare Without Harm is recommending that food service staff take into consideration additional factors indicated by the 3 Cs, thinking about the customer, your colleagues, and even the community. So as honest and transparent sourcing ranks among the highest consumers' trends and will continue to be front and center for the next generation, anyone serving food will want to connect their efforts beyond their cafeteria walls and make connections with their community. The 3 Cs are a great place to start. I will cover each of these quickly and share examples along the way. Then we will hear how Patti and Kurt have approached them. For products, the first step is to identify and purchase products that meet verifiable sustainability criteria, such as the USDA's process verified for raised without antibiotics. Third-party certifications and label claims can help you feel confident when choosing a product to differentiate among other offerings on your menu or in the retail setting. Since most food vendors don't currently communicate these product attributes at the point of purchase, we recommend referencing the Healthcare Without Harm meat and poultry product list as you get started or continue to work with your supply chain. For promotion, after procurement, it's time to make sure your patrons know that these products are unique and to celebrate the environmental or social values that went into producing them. We recommend using repetitive exposure at many points. Place a sign next to the product, an icon on the grill as pictured on the left, or think about signage on the sneeze guard like pictured on the right. Hang signs in places where the food is served and other prominent locations. Consider highlighting certifications and label claims and use language that is both informs and entices. Consider incorporating items into culinary concepts and appealing displays, such as serving them in special stations like a build-your-own panini or stir-fry station, featuring them in the meal of the day or the week or the month. Also think about ways to incorporate producers or vendors in promotion of these items by offering free samples, recipes, and details about where customers can find the products outside of the hospital, expanding both the healthy eating impact and buzz around the product. Many hospitals are also using internal newsletters, staff training such as Lunch and Learn to connect sustainable food offerings to health and wellness initiatives or programs. Food service can also take advantage of social media as well as other online outlets to promote sustainable meal offerings. Next, we talk about choosing your words carefully. We always want to aim to be as transparent as possible and communicate product attributes clearly. Using precise language and details about where and how a meat or poultry product was raised, along with the relevant third-party certifications or the USDA-approved label claims, allows patrons to fully be aware of all of the benefits of choosing that particular product. What you may see in this slide and what we know is that the market is always evolving. We know learning about the nuances of these claims is a work in progress for us all. For example, the term antibiotic-free may be seen as misleading. The USDA allows this claim to be used on products that are in fact raised with antibiotics, as long as the producer meets the specific withdrawal time. So instead of using that, we clearly want to reference how and if the products are, or if antibiotics are used, such as through the claims like raised without routine antibiotics, raised without antibiotics, or even raised without antibiotics important to human medicine. We are also recommending referencing our Using Meat and Poultry Labels document for a complete list of vetted criteria and definitions. In this resource, we have also given you some example language of how to apply this guidance. So there might be ways where you can say something like, whenever possible, we use products that are locally sourced, organic, and responsibly raised without the use of hormones or antibiotics. Look for eggs that carry the Certified Humane Raised and Handled logo, or meat and poultry items that are raised without routine use of antibiotics, followed up by the Process Verified logo. Another unique example is such that we make an effort to source ingredients from farmers who practice and support human health and environmental stewardship, protect medically important antibiotics by choosing chicken medio items with the Certified Responsible Antibiotic Use logo. When it comes to pricing, price strategies give your customers an incentive to buy sustainably produced products. There are many ways to do this without breaking your budget, such as offering a time-limited discount, again, featuring the entree or meal of the day, considering price switches between two burger selections, maybe making the grass-fed antibiotic-free burger cheaper than the conventionally raised one, substituting turkey raised without antibiotics for beef in a meatloaf entree, or even offering the new blended burger, a burger that has mushrooms or other plant-based fillers. Some hospitals, such as the University of California, San Francisco Medical Center in California, has put their old burger station out to pasture. By overhauling their burger menu and introducing fresh options, operators can offer diners an exciting new experience and update prices in the meantime. Consider offering on-trend buns, custom-made sauces, specialty burgers featuring local flavors, or creative and global tastes like a kimchi, a fried egg, and sriracha aioli. In terms of placement, we're recommending to find ways to make it easy and convenient for patrons to choose meat and poultry items raised without routine antibiotics. Be sure to offer grab-and-go or takeout options for busy employees and visitors waiting for loved ones. Many companies are developing appropriate products such as pre-made sandwiches and vending machine products like a grass-fed beef jerky. Another good place to start is by featuring these products through catering, where you may have additional flexibility with pricing and the ability to feature the benefits of a sustainably raised option. Here we're featuring Stanford Healthcare photos of their house-made takeout items. The upper left photo is a close-up of their specialty sandwich that features Mary's Chicken, a local producer raising all of their poultry without routine antibiotics and is certified by the Global Animal Partnership. So when it comes to the 3 C's, healthcare customer satisfaction scores are influenced by food offerings and interactions with food and nutrition staff. As you can read, Executive Chef Brian from UNC Rex Healthcare says, patients are becoming more educated about food. They're sitting in their beds, watching cooking shows. The expectations are so much higher now. We're seeing a lot more of the chef presence coming into the healthcare scene, and it's only going to get stronger. Technology has also brought greater consumer awareness about food venue rankings, both formal and informal. Word-of-mouth recommendations have a great influence on where people choose to eat. Healthcare cafeterias are increasingly being seen as the destination food venue as they invest in professional chefs and trained culinary staff. On the left is a picture from Palomar Health in California. They've revamped their patient tray and have had rave reviews. They hosted a culinary training for their staff this past year. On the right is Beaumont Hospital from Michigan. Last year, they hosted a barbecue for staff during their weekly farmers market to celebrate Food Day. They featured barbecue chicken raised without routine antibiotics. So for colleagues, thinking about chefs, the food service directors, and other culinary professionals, you can learn from and seek recognition from peer and professional networks in order to access another route for added exposure and marketing. Consider ways for your chef or food service staff to receive recognition among culinary and/or sustainable business networks to receive awards and other promotions. Here we have a few more stories to share. Pictured on the left, connecting with colleagues to learn about season extension, chefs attend farm tours, and product selection at farmers markets is an easy way for them to connect with their food community. On the right, we have two hospital chefs from Oregon who have gathered to compete and share their talents at the Hospital Green Chef Challenge held at the OHSU Farmers Market. Here, the chefs are from Kaiser Permanente and OHSU as they work to plate their creations. In the lower right-hand corner, Innova Health System shared with us that they do a CEO cook-off each year featuring local and sustainable ingredients. And at the very bottom, the Michigan Green Healthcare Conference moves throughout the state so new health systems can be the local co-host. This year is in Kalamazoo, coming up here on October 18th and 19th. This year they're also giving away 2 awards, one to a facility and one to a hometown hero. The Hometown Hero Award is a great way to pick a person who's demonstrated a vision and passion at the group, department, or personal level and inspires others to make change. Lastly, we have community. By modeling sustainable product selection and procurement, hospitals are not only leading by example and educating community members, but their purchases can foster new and expanded production and other community infrastructure needs. Hospitals have an important opportunity not only to increase the access to healthier and sustainably raised foods, but to transform the food system towards greater health and sustainability through local sourcing of goods and services and strategic investments. Healthcare facilities are finding ways to participate in the larger community conversation about the food system. Consider sponsoring community events or joining events hosted by other organizations where you are represented among regional food system leadership. Healthcare Without Harm is interested in learning more about hospitals investing in a healthy, sustainable food system infrastructure in their communities. Here we have a photo of a food system tour for healthcare facilities at the Dole and Bailey Meat Processing Plant in Massachusetts. There they are learning more about how they can invest in regional producers of sustainably raised meat options. So with that, I will actually turn it over to our presenters today. I'm going to go ahead and introduce both of them, and then we'll let Patti get us started. Patti Oliver is the Director of Nutrition Services for UCLA Healthcare. She has a master's degree in nutrition and an MBA, and is also a registered dietitian. At UCLA, Patti oversees patient, staff, and visitor feeding and serves approximately 10,000 meals a day with an annual budget of $23 million. While overseeing 300 employees. Patti is also the past president of the Association for Healthcare Food Service, and she has received numerous awards from them, as well as the Academy of Nutrition and Dietetics. Kurt Roessler is the Director of Food and Nutrition at Huggins Hospital, and Wolfeboro, New Hampshire, and has 20 years of experience in the food service sector, both in commercial and non-commercial venues. Kurt has been actively involved in Healthcare Without Harm community since 2013 and has brought many of the philosophies to the Food and Nutrition Department at his hospital. He is currently the New Hampshire Ambassador for Healthy Food and Healthcare and is working to educate other facilities in the state about the importance of local and sustainable food purchasing. So thank you both for joining us today. We'll pass it over to Patti for her presentation.
Thanks, Hillary. Hillary, is someone going to bring up my presentation?
It should be passed over, Patti, right?
Yeah, I can't bring up my presentation. I don't have it on my desktop. I thought it was going to be brought up.
If you just click at the top over your name and highlight it.
Now it's working. Now it's working. Okay, thank you. Okay, I've got it. Good afternoon, everyone, and thank you for having me. I want to start out by saying that we would not have been able to participate in antibiotic stewardship to the level that we have if we had not been building a culture of wellness and sustainability over the last 10 years. So I just want to do a brief history of that. We've been very fortunate to have leadership here at UCLA Health that really supports wellness and sustainability. About 10 years ago, the then CEO decided that we were going to have a wellness program and assigned me as co-chair. And we started putting together a wellness program incorporating all aspects of wellness, but in terms of food, long before there were laws about it, we eliminated all trans fats. We went around and we found we had a lot of existing healthy items that we offered in our cafeterias and for patients, but we really didn't promote them in any way. So we started, doing labeling. We started having posters and having nutritional information. We made table tents with information about how to read a food label and how to make healthy choices. And we came up with our green apple labeling program. So we had specific criteria for a food item that could have a green apple, which was then a healthy item. And those were placed not only on the patient menu, but in our retail areas. And the dietitians also got involved and made walking maps. They'd start at the front door of the medical center and say, okay, this path is 3,000 steps, or this path is 5,000 steps, in the hope of getting to 10,000 steps a day, and we posted those in the cafeterias. So this is an example of how UCLA's media relations really, uses media to communicate to the community about what we're doing. This is an excerpt from our employee newsletter that talks about one of the first things we did was to get a healthy vending machine. And prior to that, we had done an analysis and the food was really unhealthy. And now we not only have a lot of organic items, but items that do include meat raised without antibiotics. Just so some of you know, because you may have the same challenge, when I started wanting to provide more healthy options in our cafeterias, I got a lot of pushback from my managers. They said, Patti, people say they want to eat healthy, but they really don't, and we're going to lose money. And actually that did not happen. It hasn't happened at all throughout this journey. You can see on the right, there's an example of what we do several times a month. I have the chefs out in the middle of the cafeteria doing a made-to-order salad. Display cooking. We have a dietitian there with the recipe, and it just creates a lot of excitement and a lot of buzz. And since the great majority of our beef and poultry is raised without the use of routine antibiotics now, all of our signage does include that information. Another thing we did is we went to Meatless Mondays, and we have a poster out front that talks about reasons to eat less meat and specials to encourage people to eat less meat. It really probably should be called a Less Meat Monday because you can still get your burger and it is a grass-fed, grass-finished burger, but the majority of our items on our Mondays are meatless. And UCLA came up with a whole web page and a whole logo, so everything is branded that goes out about either our antibiotic stewardship or anything else is branded under the Wellness Initiative. And just to give us you an idea of our scope of service, we have 2 medical centers, the Ronald Reagan UCLA Medical Center and the Santa Monica UCLA Medical Center with over 800 beds. We offer hotel-style room service at both facilities. So this is a picture of my ambassadors who deliver the trays and an actual room service tray. And our goal was to have a healthy fine dining room service similar to that in a 5-star hotel. We have upscale tray and cutlery. Our menu features over 45 entrees, and we have no fried foods at all. We have beef and poultry raised without routine use of antibiotics, a lot of locally grown and organic produce, and we have the green apple logo on our patient menu next to foods, like some places have a heart for heart healthy. On our patient menu, we discussed having a specific logo next to the item, but because almost 80% of all of our beef and poultry that we purchase is raised without antibiotics, we just have kind of a page that talks in general about our purchasing practices, that we do purchase beef and poultry raised without antibiotics, and that a lot of our produce is organic and locally grown. So I'm just going to skip this slide because these two kind of are out of sync, but I wanted to just give you an idea. Hillary mentioned that we do serve over 10,000 meals a day. We have 2 retail cafeterias and a large catering service, and our beef and poultry raised without antibiotics are used in all of our services, not just for patients. It's used in the retail service and our catering as well. So going back to, let's see, I guess I can't go back, that's okay. Just wanted to talk about our next CEO that we got. Also was very interested in wellness and sustainability. He ended up being a vegan by the time he left. But he came to me one day and said, Patti, we're not going to have any fried food anymore. He said, we're doing heart transplants upstairs, and this just doesn't make sense. So we really wanted people to buy into it. So this is kind of another idea of how media relations is involved in, communicating with our staff and the community. So for a month, several email blasts went out to staff, and they talked not just about getting rid of the fried food, but just health in general. So this is one that went out. Another one just talked about switching to whole grains. And then it said Brew and Gold is going green. So, it's just kind of the idea we were trying to say is we're on a journey here to, increasing wellness and sustainability within the health system. Another thing that we did is we reduced the price of our salad bar from $6.99 a pound down to $4.99 a pound to try to promote the consumption of fruits and vegetables. So at the same time, our Director of Antibiotic Stewardship, Dr. Daniel Uslan, was talking to me, and at the time we used the phrase antibiotic-free meat. We were less educated at the time, and he said, I'd really like to see you start purchasing some. I was also doing a lot of work with the Los Angeles area Healthy Food and Healthcare Program and Healthcare Without Harm. So we got the go-ahead and make the purchase. Our initial purchases were just a certain cuts of meat. We still are bound to our group purchasing organization contract. So we had to be able to purchase items that were within that contract. And again, media relations got on board. They did a huge press release. And I guess the big coup, if you're in media relations, is to get in the LA Times. So they were very thrilled about that. Here's a couple of articles that came out the first week that we started using beef and some cuts of beef and poultry raised without antibiotics. And at that time, it was only a few. And we also, those of you that work in academic medical centers know that you have a lot of rounds. There's medicine ground rounds, pediatric ground rounds. So for the medicine grand rounds, we had the topic of antibiotic overuse, sorry about the typo there, in animal agriculture, and Daniel Uslan spoke, who's our Director of Antibiotic Stewardship, and Gail Hansen spoke as well. It was very well received and very well attended. So at this grand rounds is where I got up and announced that we were starting to use our beef and poultry raised without antibiotics. This is another article, and I wanted to show you the poster there. And again, at that time, we did use the term antibiotic-free. We're trying to no longer use it. But that's a picture of myself and my chef with the poster that we put out front to, you know, promote and communicate with our community that we were doing this. And again, it was very well received. People were interested. People were asking a lot of questions. At this point in time, up on our, kind of like Hillary showed on her sample, we have on our sneeze guard individual posters for each menu item, and it does say raised without antibiotics. We are in the process, hopefully within the month, our new digital menu boards will go live, and we will actually have an icon for all of our beef and poultry raised without antibiotics. So right now, 84% of our poultry is, actually it's poultry, not just chicken, is raised without antibiotics. So that's 270,000 pounds annually, and 77% of our beef is grass-fed, grass-finished. So that's 92,000 pounds annually. And some of the reason for the other percentage that we're not getting is some things just aren't available. U.S. Foods has been wonderful working with us, and Vizient is our group purchasing organization. But, you know, some things like chicken tenders or a breaded chicken, you know, those just aren't available to us, and some of the cuts just aren't available through our vendors at this point in time, and may never be. But we feel good about the percentage that we've attained at this point. A way that we've connected with other groups and organizations around this work is we have gotten certified. Our cafeterias have gotten certified. Our Ronald Reagan cafeteria was certified by the Los Angeles County for the Los Angeles Green Business certification, and we were the first hospital cafeteria to be certified. And our Santa Monica Hospital was certified Green Business by the City of Santa Monica. And I just wanted to comment that these things that we've done have also resulted in UCLA Health receiving several awards: the 2010 Food Climate Health Award, 2013 Circle of Excellence Award for Food from Healthcare Without Harm and Practice Green Health, and the 2016 Sustainability Quality Grand Prize from the City of Santa Monica and the Santa Monica Chamber of Commerce. Just wanted to comment briefly that another thing that has assisted us is that we're part of the University of California system. There's 10 campuses and 5 medical centers. There's a long sustainability policy, and some is specific to food. There are goals. One of the food goals is that 20% of our food purchases would be sustainable by 2020, and we've already exceeded that. We're at 24%. And one of the goals is zero waste to landfill by 2020. So just a couple other things we have. We have maps that talk in our cafeterias that talk about how far our food comes from, and that there are consequences for how far the food travels. And then we have a robust waste management system as well, waste reduction system, in the goal of zero waste to landfill by 2020. So we have very few items of ours disposable that would still go into the landfill, and they're simply items that we aren't available to get in a recyclable or compostable. And just, you know, to talk about, we really try to communicate to the community about our work with the antibiotic stewardship, and some of the ways that we market our food raised without antibiotic ingredients is that, you know, we do that during National Nutrition Month, we do it on Food Day, and we do it on Earth Day. And that's all that I have.
Good afternoon, and my name is Kurt Roessler. I'm the Director of Food and Nutrition at Huggins Hospital in Wolfboro, New Hampshire. We're a community hospital, so I thought I'd share some of the ways that smaller hospitals can also participate in getting the communities excited about food raised without routine antibiotics, sustainable local foods. We are also on that same journey towards wellness. We're a little later to the party, I think. I took over here in 2013. So here's some of the numbers that we're at now. About 85% of our beef is from a local farm. It's raised without the use of routine antibiotics, and it's sustainably raised. 55% of our pork and about 25% of the vegetables also come from a farm within 25 miles of the hospital. When I took over here in 2013, those numbers would all read 0. So when we started our journey with healthy foods and healthcare, I think we've come a long way in just a couple of years, and I'm going to share some of the ways that we've done it. So marketing is, of course, very important to educate the people about it. So we have quite a bit of signage around. We kind of want to bang home the message, you know, that food raised without the use of routine antibiotics is the way to go, and also to explain to people why. So near all our POSs, this is a poster that's of our local farm where we get most of our meat from. It actually describes the kind of cattle they raise. It has a picture of the farmers and where they're located. So menus are the second way we kind of want to market to our patients, guests, and community members what we're doing here. So we market on menus both the patient, the cafe, and some daily special menus. This is a shot of our cafe menu. You can see the burgers listed right on the menu as all natural. It says antibiotic free. We haven't changed the menu board yet, but we will be changing that to raised without the use of routine antibiotics. And this menu is actually right above the sign that detailed the farm. So they kind of go together, and we can interact with people about that. Another shot of the menu board in the cafe. We also market to our patients here at the hospital. So you can see this is the welcome page of our patient menu, reading that the chefs at Huggins Hospital are committed to sourcing local sustainable foods to prepare for you and proudly serve, which will read beef raised without the use of routine antibiotics, and list the actual farm name. Cafe specials are always noted on the special boards, and that our sales on items when we actually list the farm and list how it's sustainably raised are considerably higher than other items on our menu. We also promote heavily, and I've found this is really the way that you get to educate people the best about, you know, the importance of this issue is, you know, we have an employee purchase program where employees can actually buy beef, pork from the farm that we get our beef from, and it's actually delivered right here to the hospital, and the employees can pick it up right from us here in food services. There's brochures that spell that out to employees that are located around the cafe at the different POS stations. Food Day is another way that we market that to the community. We get quite a bit of off-street business here in our cafe, and our Food Day is always very popular with community members. They come to learn, I think, sometimes as much as they come to eat. we've done a number of promotions on Farm Day, where here's our food day menu, all with local products, vegetables, everything on the menu was locally procured. And this is a shot of when we have the farm come out, and what we'll do is set up a booth in the cafe during lunch with free samples of product that we've gotten from the farm that we prepare. The farm will bring literature on their practices, and you can sit and actually talk with the farmer about their farm. They have days where the public is invited to go out to the farm and meet the animals, and they promote that, and they'll always come with some sort of little giveaway, a lunch bag or a bag for people. Another thing that it's really read is some good local press. We've been in the paper a few times. I've actually done interviews with some of the trade magazines around the country, Food Management, Food Service Director of Contact, and we've done articles. So, I mean, for your hospital, it's a good marketing tool to get the word out on this and to get the word out on your hospital. We do a summer barbecue every year that is complimentary to our staff and features the meats raised without the use of routine antibiotics, which is always a huge hit, because for something like that, you'll get people who may not ordinarily come down for lunch because it's complimentary. So you get more people, and also people from the off-sites will come to this quite often. Some strategies for patients, because it is just important to educate the patients as it is the community. At our hospital, I have the luxury of doing open rounding once or twice a week to go to talk to the patients about what they've ordered and how it's raised and how it's local, and I think the patients really enjoy that, and oftentimes we'll ask where they can get the food as well, and we will also include them in the purchase program. We've shown you that we've branded on the menu. We will serve special holiday meals with special menus that will include the locally produced sustainable foods, and then, of course, education to the patient through clinical nutrition. For community and peer outreach, one of my projects this year was to reach out to New Hampshire senior leadership at hospitals across the state to kind of let them know about the problem of antibiotic overuse. So I actually spoke at the New Hampshire Hospital Association meeting to that and tried to get the word out. So now it possibly would become easier for food service directors to start to procure this kind of stuff. I was lucky enough at the beginning that I had some people on the board of trustees at Huggins that were very helpful and very interested in sustainable local foods, and that made my job much easier to come as far as we've come since 2013. The trade publications that I told you about, and the community education through farm days, the cafe visits. We've done some catering for some events outside the hospital, such as community population health forums, where we've brought out local sustainable foods and catered these events and gotten quite great feedback from the community on that, and given me the chance to get out into the community and talk to these people. So I think it's really important, and it's not as hard as you might think to start to procure these products and get the word out in your communities that that's what you're doing. That's all I have for today. Thank you.
Well, thank you, Patti and Kirk. These are wonderful presentations, and thank you for touching on all of the elements that we highlighted earlier in our guidance document. At this time, we wanted to open it up for questions, if you'd like to send those through the chat box to Melanie. We have had one or two questions come in thus far, but we would welcome others to send them, either for Patti or Kurt or even myself. So the first question that I see in this chat box is, can we explain more about the nuances between routine use and use of antibiotics for disease prevention? Would either of the speakers like to cover this, or shall I? All right, I'll take a crack at it. So, you know, as we first opened the presentation today, we talked about this idea that antibiotics are used for multiple reasons. Some are for the overcrowded and the sanitary conditions in which the animals are raised, so they're under confinement operations, and it's often that they are used to prevent disease before any animals are sick or able to spread that sickness among them, either through the herd or the flocks. So when we say no routine use, we are speaking to the fact that no antibiotics are given prior to any of the animals being sick, whether it's through the feed or the water. And then we're also addressing the type of antibiotics used as well. So today, there are both medically important antibiotics used as well as ionophores. Ionophores are the type of antibiotic we commonly refer to as animal-specific, and there is currently limited science around whether or not bacteria are becoming resistant through the use of these animal-specific antibiotics. For us, we are trying to address the upstream approach, or that root cause of why the animals are getting sick in the first place. And so that's why we bring greater emphasis to being focused on no routine use. We believe that if an animal should get sick, that it should be treated, but that the entire flock or the entire herd should not be treated. The next question came in, is I think interested in learning more about how each of you have gotten connected with producers and how you handle, it sounds like more the production rates or the volume. So we were happy today to have both Patti and Kurt represent different scale of operations. But could each of you talk about how you've been able to connect with these producers and what either certifications or label claims that they use makes you feel confident to promote them?
This is Patti. I can start. Am I unmuted?
Yeah,
can you hear me? All righty. It sounds like Kurt has done a lot more than I have on going to individual farms. Because through UCLA, we are required to purchase through our group purchasing organization. If we don't, we have to go through a whole slew of paperwork to do what's called a sole source, which is very difficult to do to justify that. We have had to go with producers who are part of our group purchasing organization. So what we're using is the poultry that is USDA process verified for no antibiotics ever, humanely raised and raised cage-free, and the certification for our beef is grass-fed and grass-finished, and so that is with no antibiotics either.
Great. And Kurt, go ahead.
Yeah, I guess I can speak about this. Yeah, being a small hospital, I mean, we actually have a group purchasing organization either, but we're really just tied to a percentage number on that, not to where we procure food outside that. I mean, Healthy Food and Healthcare was the first resource that really I used to identify local producers, and that's actually at one of my first Healthy Food with Healthcare group meetings. I actually met the woman who runs Miles Smith Farm, where we get most of our beef from. It's in Loudon, New Hampshire, which is about 28 miles from the hospital. As for how to certify what they do, I've visited the farm. You know, I've met some of the animals. I've met the people who work there, and you know, being a smaller farm, they may not have the actual certifications, but you just know meeting them. The local Healthy Food with Healthcare has done some farm tours where we've met other farms. So I think they've been my best resource. Here in the Wolfboro community, just meeting people who may have farms and going out and visiting and starting to buy, you know, some of the farms you just buy a little bit at a time. So that's how I've done it here.
Great, thank you. We just have a couple more minutes. Someone is asking about if either of you provide take-home recipes for patients or even customers that promote less meat consumption.
Yes, we do. We provide a recipe for anything, any recipe anybody wants, we provide.
And we definitely do as well. And we've even gone so far as sometimes when a patient goes home, they want to take their favorite meal with them, so we'll pack up a little takeout for that night when they get home so they don't have to cook.
Well, that's great, Kurt. I want to come visit your hospital. Sounds great. We have another question about addressing the price or the cost situation. So someone is asking, you know, how do you address this? What would be the price increase if you're willing to share, and how do you accommodate that, whether it be in retail or in the patient setting?
So the first year that we started with some, just like, I think we had 4 different cuts of beef and poultry that we started out purchasing, we did not raise any prices, and we just found some savings in other areas to cover it. For the next year, we requested in our budget additional funds to convert the rest of the beef and poultry, and we received it. And that, I think, is part of what I was discussing about having the culture of wellness and sustainability, because if that was not a priority, I think with our senior leadership, we may have not gotten those funds.
So for my end, yeah, definitely, I mean, the local sustainable foods are a little more expensive, but the processed foods that we're replacing are also actually quite expensive. So what we did was we reduced portions by 1 ounce on meats, and in our cafe we did raise the price a little bit. I think 10%, I believe, is what we raised the price. But quite frankly, since we've started in 2013, I haven't had to raise my food budget, and we've still achieved those numbers, so it can be done.
Great, thank you. So with this time, we are actually going to have to move on and wrap up today's presentation. I appreciate the questions that continue to come in, but we are getting close to the top of the hour, and we have a few items for closing. So maybe some of you are asking yourself, how do we get involved? Healthcare Without Harm is promoting Get Smart Week, which is November 14th through the 20th. And there are 3 ways to get involved for food service. You can add this official Get Smart Week poster to your dining area. We've created this. It may look familiar to some who have participated in Food Day in the past, but we've gotten great feedback on the need for more education and more promotion. You can also show off your promotion prowess by taking photos of your delicious meals and thinking about different ways to share them via social media. Consider some of the following hashtags like SaveABX, ABX Resistance, or Get Smart Week. We hope to connect with some of the photos that your hospitals might share through social media so that we can connect them through our own social media streams and our website. Lastly, we have created a new conversation starter this year. We have a button that says, "Ask me, what does my food have to do with taking antibiotics?" We think this is a great way for food service staff to get educated themselves, but then also share with your cafeteria or patrons who visit your retail outlets. Additionally, if there's any clinicians who are listening in to today's presentation, we did host a recent webinar called Making Antibiotic Resistance Real Through Storytelling. We had a medical sociologist join us who demonstrated the power of the clinician storytelling and offered practical guidance to help leverage the healthcare professionals' experiences and insight. They're able to illustrate the problem in a compelling way that leads to action. Here on the slide, you can also see a resource we put out in conjunction with that webinar. Additionally, Get Smart Week, we also have an activity for clinicians. We are connecting with the Clinician Comprehensive Antibiotic Stewardship, also known as the CAUSE Collaborative, on collecting stories from clinicians about their experience with antibiotic resistance in order to motivate transformative policy for change. You can either tell us your story by visiting our website and submitting through the submission box, or you can actually send your story as an attachment to Healthy Food at hcwh.org. And lastly, we want to wrap up today. You heard us mention Food Day, I think, on a couple of occasions. Every October 24th, Food Day is a day to inspire Americans to resolve to make changes in their own diets or to take action to solve food-related problems in their communities, whether it's at the local, state, or national level. So to celebrate Food Day this year, Healthcare Without Harm and Practice Green Health have teamed up with Menus of Change. This is an initiative of the Culinary Institute of America and the Harvard T.H. Chan School of Public Health. The goal is to help tell your story by featuring a recipe that energizes your culinary team and shares the message that hospital food can be delicious, healthy, affordable, and produced with care for the environment and the people who grow and harvest it. We'll provide you with sample recipes and culinary strategies from the Menus of Change, information on how to source local and sustainable ingredients, and as well as share and publish your recipes, stories, and photos. We hope that you'll consider reaching out and signing up to participate in Food Day, and you can do so at practicegreenhealth.org/Food Day. So with that, we want to say thank you all for attending today's webinar. As we mentioned at the get-go, all attendees will receive a follow-up email with links to the recording and the references we have referenced today. Thank you again for attending, and have a great rest of your day.